Hello, Meg Webb here, independent candidate for the upper house seat of Nelson. I've been adding to my website recently with some thoughts on key issues for Tasmanian families. One of those is health. Now, when we talk about health, we often focus quite firmly at the acute end of our healthcare system. Things like hospital beds, waiting lists for operations, emergency rooms. And quite rightly, we are questioning at the moment the level of funding provided in those spaces in our state. It's a really important role for the upper house to scrutinise the state budget each year and ask those questions on behalf of the community about level of funding and about where that funding is directed. However, if we're going to think about turning around and improving Tasmania's long-term health outcomes, we need to look past the acute end of the system, and we need to look at the funding that we have in preventative health and health promoting activities. International evidence tells us we need to be spending at least 5% of our whole health budget in those spaces, and we currently spend less than 2%. Now, given that, we have a lot of room for improvement to increase that investment and actually genuinely turn around the health outcomes for our state. And that will take the pressure off the acute end of our system also. We could even take it one step further and talk about the things that are foundational to health and well-being. The things that we know, again from research, have the most impact on our health as individuals and a community. And those are social determinants of health. And when I say that, what I mean is things like having access to affordable housing, our level of income, the level of education we have and our literacy, our gender even, the physical environment we live in and the social connections that we have with others. These social determinants of health actually have the biggest impact on our health and well-being long term. So we can think about health as being health in all policies. Investments we make in all those other areas are also investments in our health. And we can do better as a state across a whole range of those areas. So jump on my website, take a look at some of the brief comments I've made on those key areas, including health. And I'd love to hear from you if you've got suggestions for other areas that I should pop up there.